I'm Dr. Kim Allen Williams, and I'm currently the president of the American College of Cardiology and chief of cardiology at Rush University in Chicago. I am a plant-based nutrition cardiologist. There are a handful of us and a growing number as people recognize that there's enough data out there to suggest that heart disease is largely an epidemic that is due to food. And the underpinning risk factors such as diabetes, high blood pressure, obesity, they also are largely due to food. And to that extent, they should be preventable if we change the habits and the lifestyle of the people who are suffering with them and the people who are at risk to develop them. I would exclude people who have adult congenital heart disease that come to our place. Anyone who's born with a heart problem that's due to genetics or the intrauterine development, hard to blame that on diet. But the degenerative diseases such as heart attack, stroke, kidney failure, hardening of the arteries, all of the common manifestations of cardiovascular disease, they really are due to lifestyle issues that are correctable. So it's really clear that the chair is the new cigarette. And we have an epidemic of heart disease in the middle of an epidemic of sedentary lifestyle. So I don't want to minimize the effect of exercise. However, there is an exercise prescription that one has to actually sort of wrestle with. That is, we find increasing heart disease in people who over-exercise. What we really don't have is good prospective trials of sort of a 2x2 format. Bad diet, good diet, no exercise, moderate exercise, and see which group does worse. My suspicion is that, based on clinical experience, not randomized trials, which would be better, is that diet probably is the more important of the two, just because we see a lot of exercising, working out, particularly basketball players and football players have had an athletic life, and then they die in their 50s because the diet has been so bad. The diet that they're actually using to build up muscle actually works for that purpose, but it also develops plaque. And if there's not something to make that go in the opposite direction when they quit playing, they typically gain weight, the blood pressure's up, and then they have a bad outcome. There actually had been several different pieces that were put together, changing my own lifestyle in terms of how much tennis I was playing, going down from twice a day to once or twice a week. At the same time, being busier at work, and having sort of a chicken and fish, low-fat, but high cholesterol diet, not understanding that it was a high cholesterol diet, as most people don't. They just need to look up the word, Google the words cholesterol content of food, and then it would actually make perfect sense. At the same time that I had had a good patient experience of someone whose nuclear scan in my lab had actually improved dramatically with the Ornish diet. That all came to fruition about the time that I went to the American College of Cardiology meeting in 2003, had my lipids tested, as I normally would do, but I think I had skipped a year or two. Had no idea that my LDL, which was usually in the 110 range, had actually gone up to 170. Didn't actually believe it. I thought it was a plot by a statin company to make me take a drug. So I went to their competitor, and it was 169. And so I fasted the rest of the day and came back to the third company the next morning. It was still 169. So what I learned over that night is that my salmon and chicken breast, no skin, not fried diet really was replete with cholesterol. And we didn't have all the information that we have about it now, about hypercholesterolemia and hyper-responders to ingested cholesterol. And so there's enough studies saying, that cholesterol really doesn't matter. Well, that's actually true. Cholesterol does not go up very much if you're eating a lot of cholesterol. If you're a person who's eating a relatively small amount of cholesterol, it matters a lot. And it turns out that it's sort of the curve goes up and then asymptotes. And so what we would say is that diet is extremely important for those of us who are watching the cholesterol or have elevated cholesterol. There are some people, and I may be one of them, who have a dysfunction gene that raises the LDL cholesterol. In which case, if diet didn't work, then I would definitely need drugs. I would need to get back on the exercise program, and we have new drugs specifically for these people, the PCSK9 inhibitors. So, but the fact that the vegan diet worked so well for me is really great. So my LDL went down from 170 to about 90.